Hello, this is Kendria Martin, and today I'll be talking about HIM functions in healthcare quality and patient safeties. So, we'll start off with an introduction. So, my introduction states, as a healthcare professional, the main goals are to provide great quality of care and ensuring patients' privacy. These factors can influence many different things, such as drug safety, medical mistakes, and information systems. Patient safety is a key factor by protecting the patient's private health information from unauthorized release. So, my project is over 5 main objectives. The first one being data quality management, the second being HIPAA, which stands for Health Insurance Portability and Accountability Act, that was created in 1996. The third one, the security rule, and then also the use and disclosure of patient information with patient authorization and also without patient authorization. So the first one being data quality management. So on this slide, the purpose of data quality management is to ensure records are accurate, accessibility, and completeness, and done in a timely manner. So that's basically stating that all records that we handle as HIM professionals need to be done within a timely manner. Also need to have correct coding. Also, they need to be completed with accurate information in order to be billed correctly and also to be maintained in our records correctly. The next bullet point says data governance programs require implementing data quality improvement measures, and etc. So this one is basically saying that any programs that we set for ourselves as far as medical records need to improve our data quality and also have better standards for us to follow while we're setting up these records and having the patient as our number one responsibility. The next one is our Health Insurance Portability and Accountability Act of 1996, better known as HIPAA. So HIPAA was established for the protection of health information at the time, where health information was a major era for medical development. So with HIPAA, it was founded in 1996 by President Clinton. It was mostly found for protecting individuals that recently got fired from their job, to protect their personal medical information and also to protect them as far as their medical rights that they acquired from the previous job, and then also to not qualify pre-existing conditions for as far as new health information. The second one says PHI is considered as much as the patient's name or birthday. With an increase in advanced technology, having protected information is more difficult. For example, at my job currently, I work at a medical billing office, and when a patient calls about their record, or if we call them, we have to verify them and ask them for their birthday and then also their full mailing address. If the patient provides the wrong information, we then ask them for their last four social, and then if not, all else fails, we'll ask for their member ID or their insurance card. If the patient or the guarantor of the account does not provide this to us, we cannot release information to them, and we will ask them to call back whenever they acquire that information. If they say the wrong address, for example, if they have everything right but they forget the apartment number, we ask them. If they don't know it, we will not release information to them. If they ask for what date of service they saw this doctor, or did insurance make a payment on their account, if they provide us with the wrong zip code, even if it's off one letter, we will not be able to release information to them unless they have one of those 4 requirements for PHI verification. The next is the security rule. So the first one is administrative safeguards. So an example of an administrative safeguard is administrative actions, policies, and procedures that manage the ePHIs on your computer screen or a covered entity workforce. And then next we have physical safeguards. So physical safeguards are protecting anything in a physical measurement, such as equipment or the building or environmental hazards or unauthorized intrusions. Next is technical safety guards. This one means that it's protected as far as passwords, as far as firewalls, as far as desk locks at my job. When we have a new login, we're required to do desk lock. So you would have to log in through desk lock, then to log on to the computer. It's a requirement that we have to do to make sure that you are who you say you are, since our computers contain medical records, our computers contain an Epic login, and then they also contain monetary values for the hospitals. So we'll use desk lock, and that's an example of technical. An example of physical that we use at my job is as far as equipment. Every equipment that you use has to be checked out properly with your name and your employee ID number. If you do not have that, you will not be able to return the equipment, or you will not be able to check it out. Also, when you come into work every day, you have to have your ID badge in order to enter the floor that we're on. If you do not have your ID badge, you have to go to front desk, fill out some paperwork, and inquire a temporary ID that you will have to keep till the end of the day. And then once you're done with it, you have to go back to the office, check it out, and check back any materials that you checked out for that day. And then an example of an administrative safeguard is something like where we have our passwords that we have to change every 90 days to keep it more current, to make sure you don't have the same password. Then also we have our emails that we have to change every day, and we cannot accept emails from outside sources such as phishing emails. We can only send them within the company. The next one is use and disclosure of patient with patient authorization. So it says the authorization is filled out, is not completely filled out. The authorization has been revoked. Any required elements needed for authorization is missing. So for example, with my job, if, for example, a daughter called and she wants to know information about her mother's account, we cannot release any information as far as date of service, doctor's name, insurance payments, anything of that nature to the daughter without the mother's consent. So the mother would have to call us, verify her address or the rest of those 4 PHIs that we require, verify that, and then we will have to get her on our recorded line to say that she has verbal consent for her daughter to speak on her behalf. So another thing is, we have verbal consent in my job, and if the verbal consent is past 1 year, which is how much it's good for, then it's revoked. So we would have to ask for that verbal consent once more once that year is over. And then also, sometimes when patients have a date of service, they'll provide their power of attorney documents. If those documents are not completely filled out, we do not acknowledge them, and you will have to get them filled out in order for us to talk to anyone other than the patient or guarantor on the account, especially if they're over 18. The next one is use and disclosure of patient information without patient authorization. So it says, according to HIPAA of 1996, patients have many verifications in regards to their private health records. There are many examples that can violate this law without the patient's consent. Use and disclosure required by law. Use and disclosure for research purposes. Use and disclosure to business associates. Use and disclosure to avert a serious threat to health or safety. So one that really stood out to me was use and disclosure to business associates. So when we apply for a job and they ask for us to do a drug test, and we have to turn it back into the future employer that we're trying to gain that job with, many don't know, but that is your patient information without your authorization. You're taking this drug test to be turned into a future employer. You don't have authorization about it, and they will know the results of the drug test with or without your authorization. So I thought that was very interesting. That is something that we do every day, but we never really noticed that it was in regards to HIPAA or patient authorization. Another one is the use and disclosure required by law. This one, I previously had a job with foster children, and they experienced different types of abuse. For that, their health records were not private due to the fact that they were used in court against their parent or their foster parents. So we could use that as far as evidence in the case documents. And then another one, use and disclosure to avert a serious threat to health or safety. This one is very popular, especially now with parents that don't like to do vaccinations with their children. So if your child does not have a vaccination and they inquire a disease, that could be something that would be interesting to the public, because that child is out in the world and they're walking around with diseases. So it's best that we know exactly what they have. So it's best that it's not kept as a private record and it's out in the public for everyone to know for their convenience. The next slide is about impact and how I feel HIM professionals will impact the patient and also impact the facility in the long run. This is just my opinion about the job and how I feel. Next is my quote about HIPAA. It basically says HIPAA established rules that require healthcare organizations to control who has access to health data, restricting who can view health information and who that information can be shared with. HIPAA ensures that any information disclosed to healthcare providers and health plans or information that is created by them, transmitted, or stored by them is subject to strict security controls. Patients are given control over who their information is released to and who it is shared with. Thank you for your time. Have a great semester.